Overcoming depression and anxiety. Depression and anxiety are the two most common issues seen by any psychologist or mental health professionals. And when I started doing this stuff over 30 years ago, the most common, presenting issue for psychologists and counselors was depression. That has changed. And you're starting to see in many settings, like the college setting, you're starting to see people coming in more frequently with anxiety than depression, or a big combination of both of them put together, where you really can't take it apart. It's all the above, it's both. Okay? And that's just kind of the where we're at right now. Here's the agenda for today. First of all, we start with what would you like from today's session? So let's stop right there. Anybody have anything they would particularly like today or are looking for from this session? Go.
Yeah, I'm assuming you're probably going to cover maybe a couple of steps that you might have to suggestions.
Okay, so as said, I'm assuming that you have some steps that you're going to give. Yes, I will. So, all right. Okay. Anybody else? Anything you're particularly looking for today? No. Go.
I'm very interested in the emphasis on preventive things.
Prevention.
Behavioral things where you can
Okay.
learn how you can avoid getting into that
Okay.
anxiety
Yeah.
head first. Or
Yep. Yep. Okay. I would be glad to talk about that.
Understanding the body processes that actually cause those physical symptoms of the
Okay, that will probably not be much of a topic today, but maybe afterwards I can steer you in some directions to look. Okay. Let's say depression. I'll just say one thing, kind of covers all the above. Depression and anxiety are heavily related to what's called the serotonin reuptake system in the body and the brain. And do we know why? No, we don't know why. But most of the medications that are given by traditional MDs have to do with what's called serotonin, which is a neurotransmitter, and actually being able to release more of it, because it seems like people with anxiety and depression, for whatever reason, don't have enough serotonin being absorbed. So that's what we do know. Beyond that, it's really hard to figure it out. So I'll try and address a little bit, but I'm not going to get into the biochemistry very much.
Can you talk about seasonal affective disorder?
Say it again.
Seasonal affective disorder?
A little bit.
Okay.
I'll talk just a little bit about it. Thank you. Thank you. That's very helpful. There was somebody else, I think, that had a... Yeah. Yeah, I'll talk a little bit about that. I'm gonna kind of be two-directional today. I'm going to give you traditional stuff to start with. I'm going to give you traditional psychologist and talk about this in terms of epidemiology and all that kind of stuff. Then I'm going to be a little more Bastyrian and New Agey in the second part of this thing and talk a little more about mindfulness and some other things that I think are the value added in the last 20 years in psychology. Been around forever, but are value added for psychology in the last years. I think it's so important. And thank God I'm at Bastyr where you can actually start talking about some of these things in a more open way. So, all right. So agenda, we just did the first one. What is the experience of depression and anxiety? I'm going to come back to that. The prevalence of these disorders, the causes of these disorders. Let's see if this, Again, this is the first time I've used one of these, so I hope I do it right. The treatments and question and answer period. So that's what we're going to do. We'll probably take a potty break in about 45 minutes for everybody. I heard it called for the first time last week a bio break. That's so cool. We're going to take a bio break. So, depression. Van Gogh. That fits. Oops, I'll move it up. Fit better if I move it up. Okay. So that's a Van Gogh self-portrait. Depression. Says all, doesn't it? As far as real serious depression, at least, is concerned. Depression. Okay. Tell me, what is I'll do that like that. When you think of depression, what symptoms do you think of as accompanying the word that we use, depression? What are the symptoms?
Loss of energy.
Loss of energy. Very good. If I move around too much, is it going to bother your filming? Okay, all right, because you know I can't sit still.
Slowed movement or less activity.
Yes, yes, so less activity, less active.
No pleasure.
Yes, we get a fancy word for that in psychology. Anhedonia, anhedonia.
That's another word for
Loss of pleasure. Go.
Say social isolation?
Say it again.
Isolation?
Isolation, yeah, that's one I got on my list.
Negative thoughts.
Yes, negative thoughts, okay. And as to whether they're the precursor for or the result of, but it's certainly a part of the syndrome. All of that. Anything else when you experience some depression? What do you know?
motivation,
La-
decreased.
Yeah, definitely. Go again.
Lack of enthusiasm.
Lack of enthusiasm,
Loss of appetite.
loss of appetite,
Limited appetite.
Hmm?
Insomnia.
insomnia.
Disruptive sleep.
Do you get this? Think about it. Everything we're saying, to depress, you push down, everything good is lessened, correct? It's like a damper on all the good stuff. The enthusiasm, naturopaths might say the vital energy, you know, everything that seems to be good is depressed by this syndrome. And a lot of stuff we don't want, like the inability to sleep, is increased by this syndrome. Okay.
That's the loss of the sense of humor too, now.
Yes. Oh, I'm going to repeat what you said so everybody here. Loss of sense of humor. That's a real sign of getting better when you start to get your
Yes,
humor back.
yes.
Okay? No, it's a definite sign that you're starting to get better. The humor comes back.
Smiling and laughing.
Yes, exactly so. So can't sleep, want to sleep all the time, okay? Can't concentrate. Ordinary tasks seem more difficult. By the way, I have handouts. Oh!
Just shake it.
Can't operate a simple machine. No. Okay, thank you. Ordinary tasks seem more difficult. Okay, is that true? Yeah. Mind underwater. By the way, if you suffer from depression, you'll have these underwater or feet in water, slow motion, can't move dreams. You know, being almost retarded in motion, set back in motion. Overall negative thoughts, okay. Loss of appetite. Somebody said, or increase of appetite. That's true. Eating to try and overcome it. Loss of interest in things that would have previously given you pleasure, and hedonia. Loss of zest and energy for life. Thank you. Thank you, guys. I got a whole crew of helpers. This is a dream I've had. I should go through life like this. Okay. It's got to be in this little tiny zone to be able to get on the screen. Okay. Drinking or drugging to take away the bad feelings. I've been a therapist for about 35 years, and so instantly when I see alcoholism, you know, I think this is probably covering up anxiety or depression, one or the other. It's covering up bad feelings typically, because it's a wonderful drug to take away, if you didn't have to live with the consequences, to take away bad feelings. Thought that life is not worth living, okay. Let me do a compare and contrast right there, just to, the way a psychologist thinks about it. Passive suicidal ideation and active suicidal ideation. We all have feelings sometimes, what the hell's the use, and life's not worth living. Okay, we all have that. If it's turned into a drive to off yourself, to take your own life, that's called active suicidal ideation. Huge red flag for the psychologist or the helping professional. This is real serious, and you got to act, you got to do something. The mere thought of what the heck's the use is a passive thought about, is my life at value? Not a big flag unless it turns into the active kind of thought part of it. Does that make sense to you guys? That'll help you differentiate in yourself and the people around you when you really need to start being concerned about it, that this is a huge issue. But meaning of life, purpose of life, is it worth living thoughts? A lot of us have those, even when we're not depressed. The what's the use feeling, reckless behavior. And you may not think of that going with depression, but frequently a person with depression will drive too fast, overindulge in sex, drink too much, and do a lot of stuff that is really designed in a self-destructive capacity. There's a self-hatred there that people engage in. Does that make sense when I say that to you guys? Okay. Passive act versus active suicidal ideation, I already said that. Withdrawal and isolation, as you've already said. Okay. prevalence of the disorder, let's put that down there. Okay, let's make sure I get this right on the screen. Estimated that 20% of us will report at least one symptom of depression in a given year. So that's a lot, okay? 20% of us with at least one of the symptoms of depression in a given year. Surveys have found that 5% of us report major depression. Major depression is recurrent depression of a very serious nature. That's where I can't get out of bed, I can't perform normal tasks. The criteria for psychologists of when you're moving into the danger zone with depression or anxiety is, can you perform your daily functioning? If you can perform your daily functioning, sounds cruel, but you may be suffering, but you're not at a level where we say this is really serious. When you're unable to perform daily functions, you can't go to work, you've lost passion for living, you can't take care of the kids, et cetera, that's where depression and or anxiety has reached a level of where it's really critical. Okay? All right. 10% of us, over 10% of us, will have significant depression in a lifetime. That's a huge number. More than 10% of the American society will have major depression in a lifetime. Wow, that's a lot.
Their entire lifetime?
Yeah. In other words, they'll have a major depressive episode, basically, a serious depressive episode, okay? 15 to 30% of people will have major depression, who have major depression also suffer from panic attacks. Remember I said they tend to overlap and they tend to come together, which also alludes maybe the same, excuse me, brain functions are involved in both of them. The same neurological functions may be involved. Okay.
Would a panic attack be considered like extreme anxiety?
Yes. And again, we don't know. We literally don't know the mechanisms involved in this stuff. We're just kind of guessing at what the mechanisms involve. I'll get back to the panic attack. So, yeah. We'll make you panicky a little later. No. Types of depression, major depression. Symptoms of depression are ongoing and relatively constant. The episodes are typically 6 months or more. There is a huge difference between the ennui kind of feeling that many people have of kind of a low-grade ongoing what the hell's the use feeling, as opposed to major depression, which interferes with functions of daily life, the capacity to do things in daily life, and just sucks all the life and energy out of the person who suffers from major depression. These tend to be ongoing. I debated as to whether I should mention this to you because the research is indicating that it may be a fact that people who suffer from recurrent major depressive episodes actually have neurological changes of a negative nature over time. In other words, after 1 or 2 serious depressive episodes, it may actually have an impact on the neurological system and their functioning, okay? And I almost wish I had a naturopath standing right next to me right now. I could kind of talk about what some of the natural treatments for that. That's outside of my scope of practice. But it'd be nice to think that we can repair some of those neurological damages from that, you know, from what occurs. Second kind of depression is atypical depression. It's the most common subtype. Anytime a psychologist or a counselor says atypical, that also means that they can't stick it in any other category, so that's the leftover category. Atypical, not your typical. Okay. Perhaps not as deep or long-lasting as major depressive episodes. A lot of people suffer from one variation or another in atypical depression, so that becomes kind of a catch-all category. Yeah. All right. SAD, seasonal affective disorder. I have no numbers for prevalence. I should have looked that up, but I didn't. It seems to be, by the way, this is a controversy in psychology. I tend to think such an animal as SAD exists. There are a lot of psychologists that don't believe it. They just think it's garden variety depression and it does not exist. I tend to think it does. A lot of people on our campus in Kenmore have light boxes right on their desk and actually give themselves treatment every day. A lot of naturopaths use light boxes with people, and they seem to be good results. As far as I know, there's not a lot of good research, you know, on the effect of light boxes. It tends to be a northern climate disorder. where we live in places that are cold and wet. I don't know of any place like that. You might, but. And I moved here from Minnesota originally, so God, I can't get enough. So, all right. Dysthymia, fancy word for kind of mild depression, but of a very long-term nature. Okay, last a long time, but you hardly miss a day of work. When you talk to somebody, when I talk to somebody as a psychologist, and I said, "How long have you been depressed?" and they say, "My whole life." It's usually dysthymia, and that, and then I start. And I'm jumping way ahead to treatment, but I start looking there for the kind of family they grew up in, what, mom and dad's mental health history, alcohol and that, the home of origin and all that kind of stuff to try and figure out what would make a person depressed for much of their life, So, and, okay, just to mention, it is not grief or sadness by itself. Grief is a reaction to a major loss. And grief is the correct reaction to a major loss. Sadness is a reaction to the stuff that goes on in daily life. You may turn on the news tonight and see some awful story and you feel sad because you're a human being. Okay, that's just normal kind of stuff. If that grief, loss, or sadness starts to linger for a long time, and again, the criteria starts to interfere with your functioning, keep throwing that in there, then there's a problem, and that really is diagnosable depression. Let's pause for questions right here for just a minute, so just don't jabber away. Any questions about anything we've talked about thus far? Okay. Oops. We'll start in the back, and I'll come back up here.
I have a comment.
Yes, please.
Some research that I looked at lately suggests that the hippocampus shrinks.
Yeah.
And I saw one study recently that also the amygdala.
Yeah. Amygdala seems to be related to all kinds of emotional functioning and a lack of emotional control in many kinds of ways. What's going on with the amygdala? So yes, exactly so. I'm not a neuropsychologist, so I'm very reticent to get into the neuro piece of it. So it's just not what I think. Up here.
Well, I was just going to say about major depression, where it says typically 6 months or more. Of course, that's true, but a lot of times when people are that bad off, they get medication after a few weeks, and then so the duration doesn't get a chance to be 6 months.
Yeah. So in other words, the medications mask the effects.
Yes.
A lot of those folks, unfortunately, I'm biased towards psychotherapy to some extent because it tends to work. I mean, there's great amount of evidence that psychotherapy tends to work. However, I wouldn't hesitate to send somebody to get psychotropic medications if they need it. Particularly, a psychologist friend in Minnesota, and that becomes a good first choice. But you try and wean people off the psychotropics and see if you can get at getting at what's underlying if you can, unless it's truly biochemical, and you don't seem to be able to get at it. So, Yes.
To be distracted.
That's all right. That's right.
Have you watched the DVD called The Marketing of Madness?
Yes, I've seen it. Yeah. The question was about the DVD. Have you seen it, The Marketing of Madness? And have you seen the DVD? It's pretty anti-psychiatry.
It is.
And the only thing is, the only thing for me, having worked on inpatient and worked with really seriously mentally ill people for a lot of my life, some people it's a miracle that they can get on psychotropics. It just changes their lives, and they found no relief from anything else. It doesn't. Sometimes. Go.
Do you think there's a common connection between brain injury and depression?
Yes. But I can't tell you what mechanisms are involved in it, but yes, absolutely so. Brain injury and depression, even concussion, personality change. I'm sorry, I'll get off on preaching, and I don't want to preach. I've just seen too many, because I work with young people for a lot of my life in college age, and having relatively minor head injuries, falls or football or sports or stuff like that, and having personality change following, and having their MDs and neurologists not take it seriously. And it's just, it just absolutely breaks my heart when that happens, because it's a sensitive mechanism. Anytime it gets rattled, You know what I'm saying? And there are changes sometimes, and you've been rattled, and you got to take it really seriously. A young woman in class the other day, I was teaching a class over at Bastyr, and she said, I was in a car accident, it wasn't serious, but she said, I can't concentrate to read. And I said, that's a head injury following a minor concussion, but it's a head injury. And I've been trying to get her books on tape because somehow the auditory channel is working better than the visual channel. And that's, you know, so it'll help her. She can more easily learn through her ears at this point than through her eyeballs. So, yeah.
Related question. So if someone had a brain injury and a year later had the, there's some sort of evaluation, neuropsychological.
Mm-hmm. Yeah, neuropsychological evaluation.
Okay. How, for lack of a better word, accurate? How good is that?
See, what you don't know about anything that follows after an accident or so on, what we call in the trade pre-morbid. You don't know what they look like before. You don't have a measurement of that necessarily. But you can measure functioning in all kinds of levels, from memory to, you know, all kinds of stuff you can measure. And it is fairly accurate, I think, having, you know, but you don't know what they were like before. And if you had a head injury, you don't know like what you were like before necessarily. Again, that's that kind of effect of being rattled, you know. So you don't. It's hard to tell. Sometimes when this is getting off the subject, but sometimes when you're dealing with this stuff, even depression, the partner or the parents will be better reporters than the person themselves. You follow, and they'll say, "You're just not the person I married, or you're just not the the boy or girl you used to be." That's much more accurate in a sense in saying, how have you changed? Do you follow what I'm saying to you? So if you get the people around you to give you feedback, lots of times when I'm working with bipolar disorder, I'll say you need people around you to give you feedback as to how you're doing, because you're not going to know when you're manicky. You're not going to know it. It's going to feel real good. But the fact is your behavior is not normal at those points, and you need somebody who's courageous enough to step up to the plate and say, you're going toward that extreme that you get to, you know, so you can start to monitor and do something about it. I don't mean to offend anybody in my talk. I'm just trying to be honest with you. So, okay, all right. Causes. Okay. These are old terms, but I still think they're of value. Endogenous versus situational depression. Endogenous depression seems to be something that's much more biochemical or brain mechanism based. It tends to be long-term. It's kind of this permanent press, you know, effect in depression. Very, very long-going, you know, ongoing kind of depression. Okay, that's endogenous. Situational depression. By the way, when you say to a person, "Is there a causal factor that you're aware of with your depression?" and they say, "No, and again, I've always been this way," or "It seems like it's been forever," they can't point to anything, okay? I'm going to repeat this with anxiety in a few minutes because there's a similar phenomena with anxiety. Then you're dealing with something that seems like it's much more biochemically based. I firmly believe, personally, that a lot of depression is in fact chemical. And there's a whole lot of research that points toward anxiety and depression, you know, having a heritability factor, to use the fancy word. Heritability means you inherit the gene or the potentiality for it. Lots of times when you talk, you'll find other kinds of mental illness, or you find depression in that family. Now, is it an absolute smoking gun? No. It's the chicken or the egg, and you don't know if it's the family programming or if in fact it's genetic. It's really hard to tell the difference. In twin studies at the University of Minnesota, people raised apart, but in families that have a large genetic component for depression or anxiety, the SIB is actually much more likely to have it too. That points to the smoking gun, the genetic smoking gun. So, okay. If they can point towards circumstances, yes, my wife and I broke up a year ago, or I flunked out of school, or, you know, disappointed in a relation, whatever, then that tends to be more situational depression. Today, what you see all the time is we're living in tough economic times, and you see a whole other causal factor. Work is so important to self-esteem, life meaning, who you are, how you identify yourself, what you say when you meet somebody. What do you do for a living? Well, I'm chronically unemployed. Those kind of factors are situational, but they tend to result in a kind of an ongoing depression for a lot of folks because they don't have the self-esteem goodies to point to. Those are environmental, situational kinds of things. Lower thoughts do all of this stuff, you know, like depression does. Any questions or comments at that point? Another time to take a breath. Okay, I'll check in every now and then so I don't just rattle away. Last, overall sense of life disappointment, self-judgment, lack of self-acceptance, and self-worth. Some people seem to emerge out of childhood with all the above. They tend to be more likely, in my book, to suffer from anxiety and depression. It's how they were raised, how they felt about themselves as a result of childhood. Does that make sense when I say that to you guys? Okay. That's not necessarily anything chemical, but it's the factors of environment. Other possible causes. Anybody ever heard of learned helplessness? Other than we got a professional in the room. Yeah.
Yes.
What is it? You know what it is?
Learned helplessness. Yes, I went to a seminar recently with Claire Warden, who started the nature kindergartens in Scotland.
Great.
And she talked about learned helplessness in children. And I know, you know,
yeah,
there's a lot of, you know, research behind that about
yep.
you do things for them when they can do them for themselves.
Okay.
And they learn that that's how things operate.
I'm going to tell you the original. Oh, go ahead, please.
Originally, it's actually they use the Seligman experiment with the dog.
That's what I meant.
Basically,
Yeah.
the dog is very active, but they fix the dog, I say, on a table, then give it the dog electric shock, and then the dog struggle, but useless. Okay. Then later on, they remove all the strain. But then the dog free to go. When they give electric shock, the dog still stay there.
Yeah.
So that's an original idea. Then they.
So I'm going to repeat that so everybody hears all the way through the auditorium. The original experiment with learned helplessness is really interesting, and it seems to apply, definitely applies to depression and maybe anxiety. You take a dog and you put him in a cage. That's not a nice scenario anyway. And you put a minor electrical charge in the bottom of the cage. Not enough to fry them, but enough to disturb them. You turn on the electricity, and what the dog does is what any rational being would do. It tries to escape. It yelps, it bounces around the cage, and it tries to escape from this unescapable electric shock. Stage 2 of this is the dog starts to surrender to the circumstances, starts not jumping all over the cage, not barking, and results in laying in the bottom of the cage, peeing and pooping and not trying to escape from the electrical charge going through the cage. Stage 3, as you alluded to, is the experimenters opened the door. And what happened when the electrical shock was administered? The dog stays in the cage and does not try to escape the cage. Yeah, and it's not nice experiments, and I would never do that in a million years, but it's really instructive when you take a look at it. Does this generalize to humans? A lot of people believe it does. So when humans are raised in environments or in circumstances where they cannot escape the negative consequences, the result is that they tend to
Stay in the box.
They stay in the box, exactly right. They stay in the cage and they don't try to escape anymore. They give up trying to think of creative solutions and get out of it. So it's really important. And I would say to you, a lot of people that I've worked with historically over the last 35 years or so are classic cases of learned helplessness, where that's the environment they grew up in. And environments in which alcohol, child abuse, sexual abuse, physical abuse were there in the environment frequently will result in that lack of sense of I can escape life. And then very easily reinfected with the same thing, in a sense. Marrying the wrong person, lots of stuff that happens, a job that's abusive, or all that kind of stuff. And that whole thing comes flooding back in again, comes back again. So that's the learned helplessness phenomena. Whoop. Okay, just adding, just for most of us, we can only take so much, most of us as human beings. Repeated hard knocks, disappointments, dead ends, losses, they all add up over time. It's not one thing, it's a 10 things that have happened to me in the last 2 years, you know, and that's typically what you hear. And then there's that's the learned helplessness phenomena too. You know, it's just no matter how hard I try. And for some people's lives, that is so accurate and so true. And you know, as a helper, you listen to the scenarios and the stories, and it's like, what more can go wrong? I can't make my appointment today, the car won't start. Or as one of my students last week, I can't come to class today, somebody stole my car last night. And it's just like, so I'm only paying a fortune to go to school, and now somebody stole my car and I can't go there. That's the real life stuff that a lot of us do in fact live with, you know, so, okay. I'm going to mention something else, and this is kind of my thing, but it's not my thing. It's kind of written between the lines in a lot of psychology. People suffering from depression and anxiety have this long-term feeling of not enoughness, that they are simply not enough, okay? That they don't have whatever they're supposed to have inside of them that should make them able to cope with life, jump over tall buildings with a single bound, do all the expectancies. And I would say for many people, that's how they come out of childhood, with that feeling of not enoughness. Another word for that would be the phenomena of shame. The phenomena of shame. Shame is it's not conscious in a sense. It comes out as not enoughness. Shame is having felt that you did not meet parents' or others' expectations, and it's because it was something intrinsically the matter with you that you could not fulfill expectations, okay? That results in this not enough, or as we used to say in the 60s, I'm not okay, you know, kind of a feeling that you're just not enough to the world around you. By the way, that's work-onable. That's stuff that you can get at and work at.
I can see how that can come from your family, but it also seems like in some job situations.
Oh God, yes.
That is put on people, and it's
Oh,
not
God.
even, it doesn't come from within. It's like,
Yeah.
no matter how much you do, the
Oh.
expectations just keep
Yeah.
mounting.
Yeah. One time I was flying from Minnesota to somewhere, and I sat next to a stockbroker. We got started talking. At that point, this is before the market crashed, this guy was making $350,000 a year as a stockbroker. Now, most of us could live on $350 a year, if we had to. I mean, if we downscaled, and you know, we probably do it. But he had been called in the boss's office, and he was one of these big flying, you know, stockbroker firms. The boss said, "You're not aiming high enough. You know, you're not ambitious enough." He was a very good Catholic gent, and he said, "No, I have a family and I have kids. I don't want to do more. I'm already consumed by this job." But all this pressure is being put on him because the more he earned, the more the company earned. But he was a top producer already. I'm just saying there are many environments, and that's an extreme example, in which no matter what you do, you're going to be told what you didn't do. Okay, show of hands if you're willing. How many of you, your parents, in a sense, raised the bar? Any of you? Am I the only one? Sometimes parents keep raising the bar to a higher level of, okay, yes. That's great that you got a B. You could have gotten an A, though. Okay? That's just a common experience for people. Learned helplessness is demoralizing to be told constantly and reinforced for what you didn't do rather than the recognition. There's a new book called The Buddha's Brain. Have any of you seen the book called The Buddha's Brain? It's also on a CD. Yeah, it's great. And one of the things they talk about, same thing as Stephen Covey talks about, that you need to give 10 positive strokes, okay, for every withdrawal, for every negative. Because negatives, the brain is built to have, when you hear a negative, it's really big in your brain because you're wired in to avoid dangerous situations. It's your wiring. It comes from being an animal in the old days, you know? We avoid, survival. Yes, it's a survival mechanism, so we're very alert to what might threaten us. That's negativity too, emotionally, and what people say to us, okay? So that's huge. People, a lot of us, probably me too, you get positives and you don't even know where to put them. You have nowhere to stick the positive.
There's no second between.
Yeah, there's no hook that it can hook onto when you get a positive. So not only with kids, but with employees, 10 positives for any negative, you know, and so you build people up. But you're right, organizations typically don't do that, particularly when they're in the driver's seat and they can find a lot of employees. Okay. Yeah, go.
When you talk about the point there that says repeated hard knocks,
Yeah.
I think all of us have known a personality in our lifetime where it seemed like so many things happen to a particular person, and that particular person is always full of drama. And they're real things.
Yes.
But you wonder, how does this person attract all of those things?
I had an interesting conversation in my class the other day. Yes, you talk about it. What's the karma, if you want to put it that way?
What?
Yeah, I have one small class that I'm teaching on group psychotherapy, and it's almost all, well, it is all women in that class. And they had an interesting discussion that most of them didn't want to talk to their mothers. And these are women in their 30s and 40s. They're not real young, I mean, in a sense, but. And they said, because every time I talk to my mom, I just get an earful of everything that's wrong back home and with my brother or my sister, and it's like this kind of, you know, it's just, I mean, it's just really interesting to me. There's another concept, and I'll just throw it out there, and we don't know why. We don't have the vaguest idea. Something called resiliency. It seems like a lot of people, some people are just inherently resilient. You know, they're like those little toys that we had that came back up every time you'd hit them. You know, yeah, exactly. Yeah. And they tend to be like that as people. Other people, it takes much less to just knock them over. And you see that as a therapist. You'll talk to somebody, they're absolutely decimated by what to anybody else would be small. Somebody else just had the whole world come to an end, and they're relatively buoyant about it. I guess it's programming, you know, maybe it's genetic, I don't know, but you just see this difference in people, of buoyancy and you know, the ability to bounce back.
Fixable? Is it fixable?
I think all of this is fixable. I mean, that's my optimistic viewpoint. I had a client a few years ago that had been to the mental hospital every year and had ECT, electroconvulsive therapy, every year since she was a child. And year after year. And I can say, I worked with her for 3 years. We broke that cycle. She stopped having to go to the mental hospital. Was she totally undepressed? No. Okay? But, okay, I'm going to jump to the end in a sense. Let me wind back and I'll wind forward. In California, there was a psychotherapist who was a Sufi extraction, did work based on Sufi teachings. And in a book that he wrote, he said one of his clients gave one of the big secrets to everything. And the client said, you know, I have all the same problems I did when I came into therapy. They just don't matter so much anymore. That's a funny little subtle thing, but it's like right-sizing, downsizing, something about, because I don't want to give the impression that anxiety and depression totally go away. I don't see that often. They're totally gone. Whoopee, I'm a different person. No, I still have a tendency toward, but I manage it better. I deal with it better. And that seems like a rational outcome for me in terms of therapy and counseling and so on. Okay, cognitive therapy, and the purpose today is not to go into a big thing about cognitive therapy, but this is a new kid on the block in the last 20 years, straightforwardly looking about how your mind influences your mood, okay? And that how changes in your underlying belief systems and your thought systems tend to have an effect upon your mood. A lot of evidence that it works, that it helps, okay? And today, almost everybody coming out of any psychology school is coming out trained in cognitive therapy. That's how they're being trained today. Natural methods. I love working at Bastyr. Maybe sending somebody for homeopathic cure and seeing some remarkable things happen. I came here a skeptic, and you know, thinking those little globules under your tongue, like, right, you know. I've seen it work. I've seen it help, without a doubt in the world. So all kinds of natural things. Changes in diet. We've got a remarkable new staff member, Dr. Raymer, who's come to us, Catherine. She's the one only in America. She's an MD, medical doctor, ND, naturopathic doctor, and she's a psychiatrist. Okay, yeah, all three in one person. But she's not doing a lot of strict psychiatric stuff. She's doing a broader treatment because she wants to do the whole person kind of stuff. But that's an amazing thing, and a lot of stuff possible here. Cures, not cures, but at least improvements through dietary changes. Catherine is a molecular psychiatrist, so she literally looks at diet and, you know, that kind of stuff. So this is a wonderful place to get treatment in more than one modality at the same time. Louder, please. Raymer. I hope I don't say it wrong. R-A-Y-M-E-R is how I think it is. I'm not the world's greatest speller, so yeah. But she's amazing. She's hard to get into. When you come here for treatment, you're not going to see them. You're going to see the students on clinic, because that's the way we work. She or I will be the supervisor of those students. So we'll be the person that's watching the work. You're not going to get us doing the treatment, because that's not the way it works here. Oh, we do have a private practice set up within the clinic. She's not in it right now, and neither am I yet, but we do have that set up. Okay. I say perhaps medication. That's just, I'm at this place in life where I'd like to try natural things unless it's really serious before we go with the psychotropics, the hardcore stuff. But if we need to, we need to. I've asked Catherine too, do you go into your tool bag and use typical, you know, antidepressants? She said absolutely. You know, whatever we need to do. Go.
Would you consider, or do you recommend volunteering a form of natural method for trying to deal with depression? Like having the depressed person go and volunteer, give their time to help somebody else to improve their own mood?
Sure, why not? Why not? Yeah. Yep, let's move on to the topic of depression. I mean, of anxiety, I should say. I've been told I need to speak louder. If I speak too much louder, my voice will go. So I got to figure out the golden mean with that. So this is that famous painting that everybody has seen, the Scream, okay, as an illustration of what anxiety feels like. This is a modern version of the painting, the Scream. For those of you who are Fox TV fans and The Simpsons, as I am. And this is another version of it, so there you go. Okay. I'm going to need to move quicker so we get everything in. A lot, actually, of what I've said about the treatment of anxiety or depression will be for anxiety. Quickly, what are the symptoms of anxiety as you experience anxiety? What are some of the symptoms?
Racing.
Who said that? Say it loud.
Racing thoughts.
Racing thoughts. Say that really fast. Okay, no. Okay.
Sometimes audio seems, or noises seem louder, smells seem stronger.
Yeah. I want to come back to that in a few minutes, because I think for some people, anxiety is what they're calling the highly sensitive person, and being overstimulated by environmental kinds of stuff for someone who is neurologically also very sensitive. Does that make sense? Okay. It's a wonderful read, by the way, the book, The Highly Sensitive Person. It's very helpful for depression and anxiety. I think somebody who just like cued, I don't know if that's, maybe they're born with a highly sensitive nervous system. Go.
Shortness of breath.
Shortness of breath, yes. What else? Good.
Can't sit still. Like, quick
yeah, exactly. Some people seem to be wired that way, but they're not anxious. It's just, you know, yeah, but for some of us, yeah, that's a good symptom.
Racing heart.
Yes, the heart palpitations. Am I the only one that's felt like they're having a heart attack sometimes? And it's just, not just anxiety, it's anxiety, but you're not having a heart attack.
It's usually thinking about an event that is going to happen in the future, and you don't want to confront, or you're afraid, or...
Thinking about a future event, being afraid of it, running it through your mind, anticipating. Freud called this anticipatory anxiety, where we're afraid of something that might happen.
Panic attacks.
Panic attacks, yeah, that's the heart pounding, the wanting to run outside, your whole life passing in front of you. No, miserable. It's probably, okay, and what goes with the panic attack is a certain feeling, I feel like I'm losing my mind. You feel like you're going nuts. And it doesn't last, but for about 5 minutes or however long, now, take everything you got and put it together and you have a panic attack. All the above in one person in one short period of time, and you have your panic attack. I've had them before, I have. Truth in advertising, I've been working my whole life on the issue of anxiety. I'm not by nature a depressive type, but I've always been an anxious type. And that's why I also got interested in the highly sensitive person, because I think that is true of a lot of us who suffer from anxiety. It is very treatable. I'll have this on a slide in a minute. The danger, warning, okay. Danger with anxiety is you can manage it through drugs and alcohol. Danger, you can management through an addiction to anti-anxiety medications, but they don't do anything about the underlying structure. They just mask all of those symptoms so long as you are taking the anxiety medication. Dangerous. If you see people, well, I worked in psychiatric hospitals, inpatient units, people are begging for their anti-anxiety medication because when they go off, they just have all that stuff flooding in because nothing's been treated at a deeper level. Does that make sense to you guys? So that's really scary part. Go.
Are you saying that, like, on the medications, cortisol is still affecting people, or do you think it's an alleviating,
I don't know.
Oh,
I don't know.
I didn't know what you meant about
No, I'm just saying, by underlying, I don't mean that they're having a panic attack every moment. The thing we didn't say is, what do you also feel? You feel the jitters all the time. You feel jittery. Yes? The tingly, jittery, like an ongoing. I have no idea what the cortisol levels look like during the jitters. Certainly they're crazy during a panic attack. But that's like everything, it's perfect storm. All of these physiological symptoms, yeah. Something else that goes with that's really kind of dangerous for all of us that have anxiety, then we start paying so much attention to our bodies that it's just simply hard to live because we're so focused on every little palpitation, every little agitation in the stomach or anything we feel. So we start getting, I'm sorry to say this out loud, we start becoming very self-focused because so much energy is going on trying to keep it all copacetic so we don't have those horrible feelings. You know what I'm talking about? And then that becomes an obsession almost, or a precession of everything, that we're so focused on those feelings all the time. Okay, we'll talk about solutions as we move along. Okay, well done. Constant sense of dread. Okay, being on the edge, negative anticipation and worry about the future, just like you said. I'm going to make that thing go right. Excessive fear and worry. Anxiety interferes with the functioning of daily life and may result in avoiding. Somebody mentioned I didn't spell check right and had a wrong word. That's typical me. So, but I'm not going to let it make me anxious. Plagued by fears and that seem irrational. Fear that something bad will happen if things are not done in a particular way. What is that alluding to? OCD, obsessive compulsive disorder. The fear that if I don't do everything just right in a particular order, yeah, so that results in OCD. That's anxiety, just simply, serious case of anxiety. Okay, panic attacks, heart pounding, shaky, sweaty, dizzy, short of breath, talking real fast in front of a group, insomnia, fatigue, and headache. Okay, feeling of being in danger, irritability, and trouble concentrating, restlessness. Okay, we've alluded to all of those. The painting called anxiety, you probably can't see it in the back. It's a racing locomotive with a huge wave behind it, going to sweep it away. All right. Causes of anxiety disorders, I want to compare and contrast. Again, old terms, but I think they're still good. Trait anxiety versus state anxiety. Trait anxiety means some of us who have the ongoing permanent press trait to get anxious. Okay, it seems wired in kind of stuff. State anxiety has to do with we lost our job, or we're losing a relationship, or about to get evicted. There's something going on and we feel really anxious about it. And it's not an ongoing state, but it's about it, okay? That's state anxiety. It's a now kind of thing. I really believe, having seen hundreds of clients with anxiety stuff, and again, it's that piling up kind of effect. If enough things happen in a short period of time, anybody can kind of go over the deep edge as far as anxiety and have it become kind of this ongoing state that they can't escape, because so much crap has happened to them in a short period of time.
Can you repeat what you said about trait?
Trait is this kind of ongoing anxiety that may be genetically driven, maybe neurologically driven, okay? Because there is a genetic component here, a heritability, as we say. There's definitely there. So it may just be, that may be the oversensitive person that we've talked about. No, and I really relate personally to that. So it may be that as a trait, as a personality trait. Is that clear to people what I'm saying? Go.
Yeah. Can we say that state anxiety actually state anxiety may actually may become trait anxiety just because it's become chronic,
yes,
long-lasting, this kind of anxiety situation?
Yes. Yes. Can we say that a state anxiety becomes a trait anxiety? I think so. And again, I think us humans can only bear so much and we snap. We just can only take so much. I've seen very successful, relatively normal people take that one knock after another, and they can no longer, it just results in this ongoing state of panic and fear. It's conditioning. We're waiting for the next bad thing to happen. We've been conditioned by the environment and circumstances. Okay, go.
One of your points there was irritability. What about,
yes,
what about a tendency to blow up or have anger
oh, yeah,
episodes?
But also no. Here's where it gets really dicey. It's also one of the symptoms of depression is irritability, and irritated depression, okay, and this tendency to explode. That's why rather than thinking of these like this, I think of them as being maybe overlapping or very similar to each other. Probably very similar mechanisms between anxiety and depression. So absolutely, it is one of the characteristics. Explosiveness.
Isn't that part of just the fact that you feel like you can't, you're irritable, I can't get out of this, I should be getting out of this, what the heck is wrong? And then the first person that you talk to, they get the brunt of your frustration.
Exactly.
That's just a hypothetical situation.
No, it's not true at all. What's it mean when you look at this? No, no, I'm teasing. Okay. Various causes ranging from specific trauma, parents' fearful attitudes, and the oversensitive temperament, as I mentioned before. One of the first things I ask when I get somebody coming in with anxiety, obviously how long and were your parents anxious? And did they communicate worry to you? Because many people as adults who have this pattern of anxiety, they had a worried parent who gave them all kinds of messages about, it's a scary world out there. Honey, did you? Honey, did you? Honey, did you? Did you remember to? It's like this constant kind of ongoing message. It's hard to grow up feeling confident in your decisions and your capacities when you get a constant kind of dose of that kind of stuff.
So that's a nurturing thing rather than nature, or could
yes.
be both?
Well, that's an interesting question that you asked. We don't know, because it's probably some of all the above, you know.
You learn behavior from
yeah. Is it learned or inherited? I mean, or yeah, inherited heritability. Maybe both. I don't know. Again, all this stuff, and I don't want to sound negative about it, all this stuff has a big heritability factor, genetic factor. So let's say you got a mom, I'll pick on mom, she's nervous and a worrier, and maybe you got it from her both genetically and as a behavioral kind of a condition. So it could be both, so reinforcing each other.
Double whammy.
Double whammy, as we say in psychology. Okay. Alcohol abuse in the home, or anything that produced a home in which you didn't know how dad and mom were going to be today. Do you understand what I'm saying to you? If parents' mood varies a lot, if you were raised by an anxious and or depressed parent or parents, parents who were fighting all the time, your experience of childhood is to feel like the rug could be pulled out of you at out from under you at any moment. Do you see that? And as an adult, that's what you tend to be like as an adult. You're expecting the other shoe to drop. Something really nice happens. Yeah, but you better, exactly. You better not trust it, because it's probably going to be followed by something bad, inevitably, you know. I certainly grew up in a home like that where parents were constantly anticipating the next bad thing that was going to happen. Not that much really did that was bad, but they're always on edge for the bad thing. Well, they were raised during the Great Depression, and maybe some of your parents are of an age where your parents were raised during the Depression or the Vietnam era or whatever the contributing thing to the psychology of the parents during the time, and that's what you experienced. I think kids, sidebar, I think kids are psychic sponges, and what I mean by that is they unconsciously absolutely suck up all of the energy in that environment without ever being able to identify necessarily my parents were depressed, my parents were anxious, but they just suck it all in. They're like sponges for it. It's written in them, in their unconscious minds. As a rule of thumb, the earlier stuff happens to you, the bad stuff or the not so good stuff, the harder it is to work at because you can't put words to it. Does that make sense? So the earlier stuff happens. So if you were raised, people don't know this, by the way, the mom is depressed she had postpartum depression, was depressed for the first 2 years of your life. She never told you, dad never said anything. Or these mysterious things, just mother was gone for several weeks at a time, but nobody would talk about where she went. The mental hospital is where she went. And families don't have a discussion, they don't know what to do with this stuff. So the kid winds up just having this sense of distrust and weirdness and not knowing what to do with it. Does that make sense what I'm saying to you guys? And so this happens a whole lot, you know, and maybe as an adult you figure out, geez, mom was depressed or mom was suicidal or, you know, mom was anxious all the time and that's why she never went outside. She was agoraphobic, you know, boing. Okay, got to move fast. Mention the family genetic components. Generalized anxiety disorder seems more a lifelong pattern and maybe physically based perhaps. People having a natural tendency toward fear and anxiety cannot be traced to a specific problem. It's just there all the time. It's an underlying thing. We could call it as constitutional by temperament. It's constitutional. Okay, I'm going to do this really quickly because of time. I'm very aware of our time. 6 major types of anxiety disorders. The first is not stated as running late when you're doing a presentation, followed by generalized anxiety disorder, GAD, okay? Chronic worry and anxiety that generalizes over many life situations results in many physical symptoms, GAD, generalized anxiety disorder. So you get a person, it isn't one thing, it's like all kinds of things make them anxious and trigger the anxiety response. Obsessive compulsive disorder. By the way, don't think that you just have, many people have one of these. Many times they'll have all the above. Obsessive compulsive disorder, OCD, unwanted of compulsive thoughts that drive people toward behaviors that they really, at some level, know this is pretty wacky. Other people don't do this all the time, you know. Every book must be arranged in a particular order. Colors must be done this way. Got to check the door 5 times. You know, you got to do this. You got to do that in a driven sort of a way. It is maybe sometimes it doesn't affect other people hardly at all. The person suffering from it, it's hard, and they can't stop doing it because they're compelled to do it. They have to do it. So it's all kinds of rituals that are trying to take away bad things from happening and control the environment. Panic disorder, we've already talked about it, and a lot of you understand it oh too well. And specific phobias, fear of flying spiders, snakes, and all of that kind of stuff. So those, and PTSD, post-traumatic stress disorder. Anybody that's had this helpless phenomena in the face of something terrible happening to them or in their environment. They witnessed a car accident, something was killed, somebody was killed, they were in it, they were in the war, and they tend to have flashbacks, and it tends to make their life miserable. Okay, it's becoming much more treatable though. That's the good news. There's a lot of treatments going on. Social anxiety disorder, fear of social situations, fear of being judged and evaluated socially. Social anxiety tends to be about the fear of the social situation. It's the fear of judgment, largely speaking. You follow that? It's not, agoraphobia is not about, the old word is the fear of the marketplace, I mean literally. No, it's the fear of being evaluated by people in that marketplace. Okay, go.
What about a person who doesn't have social anxiety disorder, but they're a performer, and every time they have an audition, it's being judged?
That's a specific phobia, performance anxiety, and I'll cut to the chase in case you run out of time. The treatment for all of that, this tends to be fairly effective, is is actually exposure therapies. They tend to work quite well. And that is, and you can use visualization and guided imagery. They also tend to work hand in hand. But exposure means they put you in the situation and you experience it incrementally, a little bit. Sing for one person, deliver a speech for one person, then two, then a small group, and take and work your way up. Huh?
Until you overcome it.
Yes, until you overcome it. Exactly so. Okay, treatment of anxiety disorders, cognitive behavioral therapy, cognitive therapies, as with depression. Exposure therapies, a bit of the hair of the dog that bit you, proven quite effective. Yeah, the Mayo Clinic, I went through their training and treating anxiety disorders. Whole program is based on exposure therapy, you know, overwhelmingly. Guided imagery and visualization, where you imagine doing the task and you imagine yourself being comfortable with it, you know, et cetera, et cetera. PTSD treatments are now including EMDR and desensitization therapies. There's a lot of people that do that work now. There's an accumulating body of evidence that those kind of therapies work. I don't know how they work, but they tend to work. So there's EMDR, and as it's called. If you guys Google, just Google EMDR, and you'll get the scoop on it, and you can see what it is. But there are various forms of new body-mind therapies that are developing in the last 20 years or so. Even the VA has been using these newer techniques for working with PTSD with veterans. So, and they're pretty conservative about what they allow. Other stuff to follow, and that's going to happen in just a moment. Here we go. Other treatments and thoughts. Okay. One, rather than trying to take all the symptoms away, first of all, trying to learn if there's something that symptoms can teach you or tell you about yourself, or about your condition, about your past, about what it is you need to learn. Okay? There are a variety of techniques for using mental imagery to talk to your symptoms, to actually have a conversation with them, to figure out what they need to teach you. For some people, they're extraordinarily helpful, okay? To find out how to, it's a more psycho-spiritual way to engage this stuff, but to actually dialogue with symptoms, you know, to image it, to visualize it, see where it is in the body, go to it in the body, you know, and sit with it. The Buddhist way of dealing with both depression and anxiety or any strong feeling is in fact to sit with it and to be with it. Not run from it, not deny it, sit in it and be with it, okay? There's a remarkable thing about anxiety in particular. When you sit with it, you first will feel more anxious. Over time you start feeling less anxious. It's like you've accepted it, that it's there, and then somehow you're free to kind of move to somewhere else by virtue of it. Okay, number two, for the oversensitive person phenomena, I think it really is a highly tuned an emotional system or nervous system. Relaxation, okay. Fight or flight syndrome and anxiety and relaxation are diametrical opposites. You literally cannot induce the body into a deeply relaxed state and be anxious at the same moment. They cannot co-occur. Okay? So if you can induce deep relaxation at will, how long does it take to do that? A lot of practice. 6 times, 8 times a day of practice deep relaxation until through your breathing and through a little bit of relaxation work, you can experience the body chilling out, calming down right in front of you. There's a program, you can find it on the internet, for treating anxiety called the Change Program. Got 2 A's, C-H-A-A-N-G-E. It is entirely based, not entirely, cognitive behavioral techniques combined with really deep relaxation. Okay? Now they're going to charge you a couple of $1,000s for that. You didn't have to pay anything for today. So you can learn to deeply relax. There's all these tapes out there, you know, a lot of stuff you can do. Deep, deep relaxation work. Very, very helpful. Okay. Number 3, that okay, not enoughness feeling. I think therapy is the best way to get at that, to be very honest with you, to go and work with somebody, to find out the roots for the not enoughness, the shame feeling, the not okay feelings. It's really helpful to have somebody work with you, to be able to actually get into it with you. So it's worth the price of admission to pay somebody to get at it. Okay. Number 4, learn to be, I believe this with all my heart, learn to live in the now and the present moment. Okay. Mindfulness meditation, everything you do, go get all of Eckhart Tolle's tapes and books and indulge in all of them until you can do it, start to do it anyway. You're not going to become a Buddha immediately, but you can start to get there. It's a Buddhahood, you know. We're Americans, we want instant Buddhahood. Okay. If you can start to develop the capacity to control the mind at will, I use Raja Yoga, which is more based on pranayama, which is breathing and following my breathing, and it's very, very, very effective. Okay, so that's stuff that you didn't used to hear at all from a person like me. Okay. It's very hard to live in the now and not either in the past. If you're like me, you run those old failures and the stuff you did wrong and the embarrassing moments over and over and over again, and then have negative anticipations toward the future of the same stuff. Nowness is the opposite of that. To learn to be now, you know. Okay. Train yourself to do what the Apostle Paul instructed. I'm out of a Christian background. Whatever is true, whatever is noble, whatsoever is right, whatever is pure, whatsoever is lovely, whatever is admirable, if anything is excellent or worthy of praise, think about these things, okay? So to try and program yourself as positively as you possibly can. Or as the Greeks of old said, dwell in the good, the true, and the beautiful. In other words, try and really make it you're going to preoccupy your mind with all the bad stuff. Why don't you preoccupy it with good stuff, you know? And stay away from those folks who infect you with badness, the negative folks. If you need not to watch the news, don't watch it. Be ignorant, but be happier. Okay? Even if they say the end of the world is coming, what can you do about that anyway? Why bother? Okay. I've had really remarkable results in my own life as a chronic anxiety sufferer of doing heart-centered meditation work. So I can feel an outgoing sense of love and compassion for myself and other people and not be preoccupied with poor me and all of my anxiety feelings. That makes sense? Yeah. And it's a real discipline, and you got to work with it. It's not an overnight fix. It's a long-term. These are longer-term kinds of things. But to learn to meditate, to learn to watch your breathing and to go inside and to come from your heart toward other people and yourself, it really is effective. In the yoga, all this emotional crap is seen in the solar plexus, and part of the pathway in the yoga is to raise it to the heart, because in the heart it becomes love. Here it's agitation and emotion. Here it's love, self-acceptance and other acceptance, and a feeling of being connected with everybody in a nice way. In a good way. Okay, so that's going out on the limb for you guys. All right. All right. Cultivate a life purpose. Believe it or not, most people don't know what their life purpose is, and they haven't enunciated it, and they don't have a personal mission statement. These things kind of recession-proof us. So when the bad times come, we have a sense of what we're about. Even your life lesson, for those of you who are spiritually into that, what are you here to learn? Why those parents? What are you supposed to learn from those parents? What your early childhood, wherever you grew up. I grew up in South Central LA in the hood. It was a tough growing up. But why that lesson? Why did I do that? What was that about for me? If you believe that, why'd you choose it? What is that for you? All of that stuff is mission and purpose stuff. Do you see what I'm saying to you? The more you have of that, the more recession-proof, because you feel like you're bigger. The you is bigger, and you're here with a purpose, even when bad things happen. You're here with a purpose. Okay. Learn to practice detachment, and that's a certain don't care attitude, as they say in the yoga. That detachment is not a negative surrender. Detachment is, I'm going to stand back from it emotionally, because all my emotional intensity is not going to make it one bit better. Not one bit. It doesn't help at all. I'm going to stop my spinning and detach, okay? And radical self-acceptance and self-forgiveness. And that's also a heart-centered practice, and it comes out of Buddhism. And it's the practice of learning to accept self and others and to forgive you no matter what you've done or what your foibles or shortcomings are. You can learn to and whatever that no good guy did to you, whenever they did it. You can learn to forgive it and let go of it and accept it. Questions, comments, anything? Did my battery expire yet? So, came up to me, such a nice man, such a totally nice man, during the break and said, your battery will expire soon. I didn't know it was my pacemaker he was talking about, or this, you know, not my anxiety, no. Yes, exactly, you know. Go.
Can you comment on the correlation, maybe the strong correlation between anxiety disorder and depression?
I don't know it statistically. We have another therapist in there, but I don't know statistically what it is. All I can see is what I see on an ongoing basis in practice is they're just twins. They co-occur more and more. I said at the beginning of my practice, it was depression without anxiety as often. Today it's both presented simultaneously. Pick one. What I did at the end are techniques that work for both. Mindfulness, yoga, breathing, guided imagery, relaxation, they work for both. Okay, they generalize. Let's go here first, like you were first.
Is there a particular breathing exercise that you find is very simple that you would be open to sharing?
Oh,
too much time?
Yeah, all of the most simple of all, the most possible simple of all. It'll come back to me in a minute. The guy that taught all of this stuff to business people, and he's teaching this like 1 minute stuff of breathing. It'll come back to me in just a second. That's right. Hmm?
Not Anthony Robbins.
No. It amuses me. He's a psychiatrist, and he wound up just creating. It's a simple breathing of when you breathe in, you count 1, and when you breathe out, you count 2. And he charges like $10,000 to go to his clinic to learn 1, 2. And learn it. The relaxation response. The relaxation response is the book. It's about 25 years old. That's just based on the simplest yogic breathing practice known to man, just simple breathing.
Benson?
Herbert Benson. Bingo. You get the prize. Is there a prize? No. All the way in the back, and then we'll come forward.
Can you describe the services here at Bastyr and the different shifts that might be helpful to someone?
Yeah. What you want to do, you got to go 1 of 2 ways to get your foot in the door when you come into Bastyr. I don't have the number in front of me. Do we have the number? We can make sure you get it. But say it loud.
834-4101.
Is that good? Is that good? Can you even pay for that kind of? No. Decide whether you're going to come in through the counseling track or whether you're going to basically come in through the natural medicine track. And that's up to you. That's really up to you where you want to start. Either way, we can refer. By track, I mean when you come in, you can say, I'd like to come in and see somebody to counsel as a counselor, okay, a mental health provider. Or you're going to come through naturopathic medicine. The third alternative, which I don't know really well, would be Oriental medicine, including acupuncture. And that I don't know as much about. Loud.
Can you describe the modalities in the naturopathic medicine track?
You want to talk? Stand up, just if you can. Or loud, loud. Okay, go.
Homeopathy.
Is that what you're going for?
Yeah.
Well, stand up, you do it then. Come on. That was like, okay, that's like baiting the witness or something. Okay. It was a total one. Now go.
Clinical biofeedback here with Dr. Brad as well. And a lot of what he's talking about with heart-centered meditation and pranayama and the breathing exercises is amazingly effective, amazingly cheap, and requires practice and diligence to generalize into your daily life. So the biofeedback shift is wonderful.
Good point.
My family has benefited from it. I've benefited from it. But the homeopathy too, more and more, my eyes are being opened as to that. And then, so like my question really actually was more around how do you coordinate care? And is there a lot of communication between counseling, biofeedback, homeopathy?
Sometimes yes, sometimes absolutely not. Just depends on the provider and how aware they are when they're doing it. On my shift, I can speak for my shift in counseling, we entertain a fairly lively debate of whether the services this person could benefit for. Now, lots of times, now I'm a supervisor, so I'm the doctoral supervisor for a group of naturopathic doctors in training, and there's typically 6 on a shift. and we'll have a roundtable discussion about, and it's fairly lively. No, I think this is cranial sacral work. I think this is, and it's a different kind of a modality. This looks like homeopathy, and you know. Here's a great thing about natural medicine. It has multiple modalities to choose from. That's also good if A doesn't work, let's try B. You know, and I didn't mention biofeedback. Thank you for doing that. Absolutely, absolutely cool. So all of these modalities are possible. Probably, I would say, I want your input, you guys are in the ND program. I would say the best thing might be to start with what's called a patient care shift here, where you come in kind of and have an initial assessment, because they're going to look at your whole self. And because what you're calling an anxiety issue might wind up being dietary, or it might wind up something else, you know, an allergy of some kind, even a medication allergy. And so they're going to do the basic overview workup thing. They very willingly and eagerly refer to counseling if they think it's going to help. That's my experience here. And then off of counseling, we refer the other direction if it. Would you agree with that, you guys? Okay. All right. Thank you. Go.
So if a person has depression but also has an addiction, how are those two co-occurring disorders a treatment plan integrated?
That's a really good question. Here's how I was trained, but this is less so anymore. We used to try and treat the addiction first. That's the way I was trained, so we could get at the psychological issue. Now they're treated at the same time. And so what you would have to do, if a person were being treated for an addiction off campus or somewhere else, then we need communication and medical records exchange between us and the provider off campus. If it's on campus, it would be someone, you know, maybe between counseling and one of the other modalities for the treatment. So I've been here 1 year at this point. I've not had a client yet that was kind of had that co-occurring disorder in that way. So that's the best I can do with that. Anybody else know? No? Go all the way in the back. We have a counselor in the room, well-trained counselor.
Thank you. Did somebody ask the connection between anxiety and depression? And I have a comment about that.
Please.
My working model, my first model is that it's stress, excess stress connected gets that either cortisol seeping or pumping without adequate attention to repairing the damage.
That's pretty good. Yep. Yep. How could you be in this society and not be, honest to God, you know, how could we be in this society and not be to some degree stressed? And if some of us are more susceptible than others to the effects of that, bingo. You know, back there, loud.
How do you feel that caffeine interacts with anxiety?
Oh,
Can you be a caffeine addict and still treat anxiety?
A lot of people in whole, okay. There's also a paradoxical effect for some people too, but for most natural people are going to tell you to give up the caffeine or really limit your caffeine intake to really get it down. It makes, no, it just, what happens when you drink coffee, even if you're normal, quote unquote, your heart pounds and your blood pressure goes up slightly. For anybody, so to switch to herbal teas. And I've recently switched to green tea for that very reason. I don't need the extra jag. I like it, but I don't need it. So the paradoxical effect is in some people with hyperactivity disorder that it actually has the opposite effect, and when they take the coffee, it makes them calm down. Go figure. Got to be one in every crowd. Got to do the opposite. We have like 1 minute left, and I want to honor the time. Where are the handouts before we way in the back? Okay, so we can do that on the way out. Ask your question.
Can we email you or contact you?
C.E. Smith, or C. Smith it is here, C. Smith. My home one is C.E. C. Smith at bastyr.edu. C. Smith at bastyr.edu. Sure you can. No, I can't do any treatment or anything like that. That'd be unethical, but yeah. But if I can help send you to a resource or something, I'd be glad to do that. And everybody is always welcome to come to the clinic. And again, patient care shift, or if you want to start with counseling, you could do that. We have shifts pretty much every day and night, so Yeah. So thank you, everybody. Namaste, and thank you. Thank you.